Okay.
Okay. There he goes. He's got a nice shirt on, Mike.
Mm-hmm.
He's a nice burgundy shirt. That's a good color for him.
That's a good color.
What do you? There's no need
to see my emblem better that way.
I was going to say you're not taking off your shirt, are you, Mike?
No. You're not that lucky. No.
Some people pay high dollar for the topless farrier.
Yeah, they wouldn't pay me.
Well, you could advertise topless farrier, and then you show up, and they're like going. They thought they were going to have like a.
Well, I wouldn't have to wear a hat. You know.
You can wear a hat if you want, Mike.
Okay.
All right. You ready?
Yep.
Here we go.
And now for something special. The unit is self-contained with its own saddler, farrier, wheelwright and so on. It's a rigorous training dished out who know all there is to know about horses, and it brings results.
We take you behind the scenes now to show just some of the interesting aspects of this training.
Welcome back to Equine Dynamics with Mike Stine, the award-winning #1 podcast to create sounder horses from the ground up. Mike Stine is a registered journeyman farrier with an APF 1 accreditation. On this week's show, joining us here in the studio, we have Dr. Mark Wooten, a DVM, who's going to talk about vet farrier and ownership relationships, farriers' effect on the nervous system, and also a holistic approach to lameness, diagnosis, and treatment. All this and much more will be discussed here on Equine Dynamics with Mike Stine. And my very own holistic medication man is over to my far inside is Mike Stine. How are you?
I'm doing good, Travis. How are you?
I'm doing well. How are things going this week, Mike?
Incredible. Spectacular.
I know.
Magnificent.
Well, we're doing 2 shows in 1 week, which is great. So
that's a lot, yeah.
So one thing I was worried about, I was sitting there before the show today. I was like going, God, nothing's really happened since this past Monday when we had Taryn on here.
A lot's happened.
Well, with you, Mike, what has happened with you? You came in, you were all excited. You were jumping up and down. You were clicking your heels like a leprechaun. What's going on? What's the excitement about?
It was the cereal I ate this morning.
The Lucky Charms?
Lucky Charms, yes. No, I got to spend a little time with a Mustang yesterday.
Like Ford Mustang or an actual horse Mustang?
No, horse Mustang.
Oh, okay.
One of my customers had taken one in that a little while back that had, I think it was having some people problems.
Okay.
And so they've spent some time with it, gotten it. When I first saw the Mustang, it's like, you can't come back here because it will panic when it sees you. So the other day, other people have been around it and touching it, getting to where you could talk to him a little bit. And
was he a rescue Mustang, or was he? I mean, how did he get to be so timid?
Well, I mean, he's a Mustang, and people are weird, or she. And the people who apparently had the Mustang were having some issues, and she was willing to take the Mustang in to spend time with it, which, putting too much pressure on it's a bit of a problem. But they had eased to the right side of the Mustang and got both front and hind, but the Mustang was very protective over the left side. And so I spent some time handling and brushing and talking and all that, and ended up getting all 4 feet up and got down the left side all the way to the hind end. And Mustang says, well, you don't smell too bad, so we're going to let you mess with us some. So that was good. It's been a long time since I've worked with Mustangs.
And why are Mustangs so far and few between for you to work on?
Well, the Mustangs that I had worked at that level were a couple that I had gotten from Doc Redden, and Sally's in his early 20s now.
Now that was your horse,
that
Sally.
Was my horse, yeah. But see, when I first got Sally, he went down a chute into the back of a stock trailer. We pulled the gates shut behind him, and he was in the trailer at that point. You know what I mean? And it was working to get him to accept the halter, working to get him to accept people, working to accept a spray bottle, and everything else. You know what I mean?
So the Mustang you were working on,
right?
This person just got this Mustang, I'm assuming.
She's had the Mustang for a few months.
Okay, so this is still a new horse for this person.
Fairly new for this person, but came from someone else who's been in the domestic world for a while. But there was was panicking from people.
And why did they choose to take over the Mustang? Did they like a challenge?
Well, she's taken in a number of horses.
Okay,
and the Mustang was not fitting in well where it was, and she wanted to try to give it a chance.
So what are the is it a rescue place? I guess is where I'm going. Is she taking this horse?
I don't know if she's officially a rescue place, but she's taken in a few horses. She's also she's a large animal veterinarian.
Okay.
And
so her job is to take care and make sure these horses are going to be good horses for people further down the line.
Some of them have been placed out. Some of them she will keep indefinitely. She said the Mustang she will keep indefinitely.
So did you have a good time with this Mustang?
Yeah, we got along. It smelled me and says, "Yeah, you smell weird, but I'm gonna let you. As long as you approach me right, I'm gonna let you approach me a little bit."
So what they said was when
they'll tell you if you're approaching them wrong.
And what they said was, "Oh, this horse is going to be completely out of control. Let's call Mike."
No, yeah, but no. The horse when it first was in the barn, when it had gotten it to the stall and all that kind of stuff, just come near the stall, it was cowering in the back of the stall and
poor
snorting
thing.
at people and all this kind of stuff because of don't know how much handling was done, don't know how the handling was done, don't know if the Mustang had been pushed into a panic, don't know what had gone on.
So you were able to touch all 4 feet.
I lifted all 4 feet, patted them on the bottom, took some slow and easy, and there was a couple of times that Mustang says, "You're not approaching me quite right," and I had to back up and decide what I was doing, and the Mustang gave me a chance to reapproach.
Were you able to trim the horse's feet, or
no? I wasn't even attempting to trim at this point.
Okay, so this is just a meet and greet.
Get to know, see if we can even touch a leg.
Right. Well, good. Are you going to see this horse again?
Oh yes.
Yeah,
we're friends now.
Oh, good old buddies. Do you know the horse's name? Have you given this Mustang a name?
I can give it a name, but I don't know if it's what the owner's calling it.
Call it Mach 3.
Yeah, there you go.
All right. Well, we got a lot to talk about, lots to get into, and we have a special guest joining us here in the studio. And don't forget, for every podcast we do, we have a YouTube channel over there. You can see this in real time as we're talking about here. You can see the full-length podcast over on Mike Stine's YouTube channel. Just search Equine Dynamics over on YouTube. And when we come back, we're going to talk to Dr. Mark Wooten, a DVM, here on the show. So stick around. You're listening to Equine Dynamics with Mike Stine. He'll be right back. So that's let me turn it back on. So that's basically how the show runs, Mark.
And we're done.
So we're going to bring you on, and I always do, the way I kind of introduce the person is essentially how you got started and what kind of, what's your background, what's your credibility and stuff. Is there a way you can lower that camera a little bit more so you're more centered in picture, or is that?
I'm not seeing me on the camera yet.
I got you on mine.
Uh-oh.
Well. There you go. Perfect.
Go.
That's perfect.
Okay, well, I just won't watch me. That's probably better.
Well, I've got you on our end. There might be a setting on your side that you might have to click to make sure that shows your camera.
I blew it up, and now...
You're on there.
Okay, I'm fine.
Can you see us, though?
I see you guys great. I really don't want to look at me anyway.
Well, we got you on the camera, so
that's why I painted the mirrors in my house.
Don't commit any crimes while we're doing this.
It's quite a long night, and I know I look a little rough.
Nah, you're perfectly fine. All right. Welcome back to Equine Dynamics with Mike Stine. Don't forget, you could join the podcast at any time, and the way you do that is go to equinedynamics.com. At the very top of the page says Join the Podcast. Click on that. Opens up another screen there. You can see all the different shows that we've been doing over the last 4 years. We're wrapping up season 12 here. We got one more show after this, so once we're done with that, we take usually about a 2.5 week break. So now's your chance to go over there and get caught up on all the shows you might have missed. Just go to equinedynamics.com, and we'd love to hear from you on that Join the Podcast page. There's a little orange bar at the top. If you got a microphone on your device, you can speak right into your phone, your tablet, anything that's got a microphone. Record your voice, send it right to us. You can be anonymous if you want. It will ask for an email address just to make sure you're not a robot. And your voice can be heard right alongside of us here in the studio over at equinedynamics.com. And over to my far hand side, my very own voiceover actor is Mike Stine. How are you?
I'm doing good. Travis, how are you?
I'm doing well. And joining us this week on the show here in the studio, we have Dr. Mark Wooten, a DVM. Dr. Mark, can I just call you Mark? Can we be casual? Absolutely. Mark, thank you very much for joining us this week on Equine Dynamics. How are you?
Very well. My pleasure to be here.
The question I have for you is, first of all, where are you from? Where are you broadcasting us from or joining us from?
I am in just outside of Nashville, Tennessee, community of Thompson Station, Tennessee. We're just south of there. I work out of a facility called the Jekyll Center, and people can go online, look that up, jekyllcenter.com. And it's a real privilege because it's a beautiful facility that I was invited to come put my practice in. I'd been in the Nashville area for 25 years prior to that, and my hospital that I had was overrun by urban sprawl, and I was just kind of taken over by the city of Nashville. And folks at the Jekyll Center, I started doing. They saw my plight, and they said, "How would you?" And I said, "Absolutely."
So, all right, I'm going to just pick up somewhere you were talking about Nashville. So I just came back from Nashville, Mark, and we were just there, I think, a couple months ago. We went on a little vacation up there, right in the heart of the Gulch. I'm sure you're aware of where the Gulch is. We were there when all those tornadoes and stuff came through. A few weeks back? Did any of that touch you where you were at?
No, fortunately where we are. Well, I take that back. My farm, we didn't get it, but at the office at the Jekyll Center, yeah, we were standing outside watching a funnel cloud go by about a mile up from us.
Yeah.
And, I don't think it touched down, but it was pretty exciting.
So tell me again about the facility that you were at.
The facility I'm at is called the Jekyll Center. I was invited to move my practice there. I've been in Nashville for 35 years now. 11 years ago, I started doing the work for the Jekyll Center, and they invited me to move my practice there, which was quite a godsend in that the city of Nashville was overtaking my hospital. When we originally built the hospital, we were out in the country, and then all of a sudden we've got strip malls and more traffic than you can imagine, and no one could get a trailer in there. So I've been at the Jekyll Center for about 11 years now, just over, and it's a fabulous place. You can go online and look it up, jekyllcenter.com. The practice that I work out of there, it's called Equine Performax Veterinary Rehabilitative Services. You can look that up online. And I kind of overlook the rehab part of the practice of with the underwater treadmill, the cold leg spa, laser therapy, all the different type of therapies that are there, and we have therapists that provide that, and they do a tremendous job. I just kind of look over their shoulder every now and then if they have questions regarding that. Prior
to going on the air here, right before we started the show, you said you had a late night last night. You were dealing with a foal. Tell us that story before we dive into the context of the show. Tell us because that's exciting to me.
Yeah, well, along with working at the Jekyll Center, my wife and I also have a breeding operation. She has done the breeding. Carolyn, my wife, has done the breeding work for numerous farms. And when we got married, she said, well, let's put something together now. And I did. When I first got out of vet school, I was actually resident veterinarian on a standardbred breeding farm. We bred probably about 600 mares a year. So I had a lot of experience with that. And we got together and started this. And so last night we had a foal born, and he was a little on the small side, a little on the slow side. So we had to do some stuff with him, but he's coming around. He's starting to nurse and that sort of thing, but made for kind of a long, late night.
So the reason why we have you on the show is because there's a lot of things that you'd like to discuss. And one of the things that you're real enthusiastic about is the vet farrier and ownership relationship between those. Tell us why is that so important to you, being in the position that you're in?
Well, I mean, that's critical for the horse. The horse is the primary, what we're looking out for the most is the horse. And the combination of the farrier, and I'm sure Mike sees this all the time also, the combination of the farrier, the owner, and the veterinarian, it's critical for the health of and well-being of the horse. What I can bring to the table is information for the farrier through radiographs and that sort of thing, and we can look at that together and come up with a shoeing plan for that horse. And it's interesting in that all farriers have different levels of that they're working at, and just like veterinarians, their experience with it. I've been very blessed to get to spend a lot of time with Dr. Rick Redden. Dr. Redden very well known as a podiatrist all around the world, and just a brilliant man, and has taught me so much. I feel like he still tells me I'm in grade school, but anyway.
Right.
How old is
Mike, have you gotten past kindergarten?
No, nowhere near it yet. I've known Rick for 30 years anyway.
How old is Dr. Redden right now? How old is Dr. Redden right now?
I'm guessing Rick's 78.
I think that sounds right.
And Mike talks about
Still going maniac.
Yeah, and Mike talks about Doc Redding all the time, and we've had other fairs that have been here on the show over the last several years. Do you see? I know you can't speak for him. Do you see him retiring, or is there someone that's next in line to take over that quote unquote Doc Redding title?
I don't think anybody could ever take over what he's done, and I think he'll go as long as he can.
Yeah, Rick is one of a kind. He's amazing. It's always changing. Because he's always thinking. Rick, this is how we were doing it last week. Yeah, well, we don't do it that way anymore.
Yeah.
Right, I found a better way. I always found it. Yeah.
Yeah, I found a better way, and he's right. He's always looking for a better way. He's never static in what he's doing. Also, I've been really blessed to have a farrier here in Nashville that. He and I worked together since the early 90s, Danny Dunson. Danny's a great friend, a brother. We just love working together, and it makes very enjoyable the things that we've done. We started off working together a lot with the laminated horse, which, boy, when you're working with the founder horses, it really is a partnership between all three of those, if everybody is on the same page. And especially the owner. We really have to get their guidance of what they're wanting to do here, what they're wanting to accomplish, and recognize what we can do. And it comes in all, and I'm sure Mike can attest to this. You have all different types of owners, those that will try everything and anything, and those that are, when you first start with them, well, how much is that going to cost?
Right.
Those are the tough ones, because breeding a founder horse is very, very difficult.
I've had people that brought Rick in, and I've been there to do whatever he asked me to do, and brought him in up to the university and the whole bit. And then other people I want to wait to see what happens. And I'm like, you really don't want to do that.
You don't have time to do that.
All right, we're gonna take
rapidly evolving thing.
All right, we're gonna take a quick little break, and when we come back, we're gonna dive into Dr. Mark Wooten's idea as far as the farrier's effect on the nervous system. So stick around. You're listening to Equine Dynamics with Mike Stine. He'll be right back. Mark, you're doing good.
Okay, great.
Yeah, you're doing good. Mike, not so much.
You haven't got much to work with here, but you know that.
Mike, not so much. Mark is a 9. You are about a 3.2 right now.
That's really good for me.
No, I have to give him a welcome back to Equine Dynamics with Mike Stine. Don't forget to follow him over on Facebook. He's always posting different articles up there. He also reposts the show if you missed it here in real time as we're doing it here on the show. He always posts the YouTube video up on his Facebook page. Just search Equine Dynamics Mike Stine over on Facebook. Give him a little subscribe, follow. I forget what they do on Facebook now. What do the kids do on Facebook? Are kids on Facebook anymore?
I have no idea what kids do.
So anyways, if you're a kid at heart and you want to learn more about the equine world, go over to Facebook, search Equine Dynamics Mike Stine. He's got 2 pages up there. He's got a personal page, which he basically just regurgitates what's on his business page. So either one, it's a win-win no matter what you follow him over there. And over on my far hand side, my very own follower is Mike Stine. How are you?
Doing good. How are you, Travis? And how are you, Mark?
I'm doing well.
Doing great.
And joining us this week on the show is Dr. Mark Wooten, a DVM, and he is joining us here all the way from just on the outskirts of Nashville, Tennessee. I almost said Nashville, Kentucky for some reason. I don't know why. Nashville, Tennessee. And so we're going to talk about the farrier's effect on the nervous system. Now, on last week's show, we had Taryn Smedley,
right?
And she's a body worker. And so she goes in and she was talking about opening doors and closing doors and working with essentially the nervous system and the muscle system and all the tissue and stuff. So when we talk about a farrier's effect on the nervous system, technically you don't really think about that. You think of more of the joints and the bones and stuff. Mark, what do what do we mean by the farrier's effectiveness on the nervous system of a horse?
Just what you said about the joints, that is critical. And I'm sure Mike tests this, the alignment of those joints, the proprioception that is being sent to the nervous system by the alignment of the joints is critical. There's so much information coming from the joints to the brain, to the sensory cortex, as far as knowing where the body is critical. And since I've been practicing the AK, it has really become apparent to me as doing muscle testing and that sort of thing of how much we can change the workings of the nervous system. Taking muscles and putting them into spasm simply by not having proper alignment and that sort of thing. It's really been eye-opening to me. Danny, who I work with, he's extremely good at recognizing these issues as far as alignment and what it can affect the proprioception. Another condition that I see an awful lot of an incredible influence on the nervous system is at one of Dr. Redden's meetings years ago. There was a farrier from England named Ernie Bailey, and Ernie described a condition called Oblique Knee Syndrome. And he was primarily talking about just the way the conformation of the knees, the carpus, that they were turned out, and it caused the horses to be very locked up. The foot would grow in a very unusual position, and he primarily talked about what the effects that it had on the foot, that these horses often had severely sheared heels, they had collapsed medial walls and that sort of thing. But he made one statement at the end of his talk. He was a farrier in Newmarket, England, with one of the big hospitals over there. And he made a comment that really caught my ear because I'm not a farrier. But he did say that the massage therapists and the body workers at the hospital always commented on, excuse me, on how sore these horses were in their lower neck and shoulders. That caught my ear, and I started looking for it, and he was absolutely right. These horses were often very sore in that. And doing my chiropractic work, I found that these horses just would not allow me to manipulate them. They were extremely sore. Some of them so sore that if I literally just touched them along their scapula, they'd try and bite me. They were that sore. And one day I was trying to adjust this horse, and I was trying to get him to flex his neck. He was having nothing to do with it. He was getting mad as heck at me, and I was a little mad at him. And there was a farrier there that was supposed to be shoeing the horse, and he's getting mad at me for, ticking off this horse that he's about to get under and everything. I said,
that's always appreciated.
Yeah. You take him. I can't do anything with him. And so I just stepped back and leaned against the wall, and the farrier pulled his front shoes, got them both off, and walked away, took the shoes over to his truck. And that horse almost immediately took a big, deep sigh, dropped his head, and just went to sleep.
He said, thank you. That's what he said. He said, thank you.
What the heck? And I went over and started checking this horse, and all those muscle spasms just cleared away. They went away immediately. And all of a sudden, the horse would let me adjust him. I could work on him. And I thought, wow, this is really crazy. This is something. And Danny and he had always been working on something he called the frog stay apparatus. It's a little process of the frog. You really can hardly see it unless you have a hoof capsule that you can look at. And it's quite a large dorsal fin. And he always lined up the breakover point with that frog stay apparatus. And I noticed that these horses were none of them lined up with that frog stay apparatus, because this conformation causes that hoof capsule, as it's leaving the coronary band, those tubules want to rotate to the inside. And if we follow that foot and we're applying the shoe to the bottom of the foot in alignment with what's happened to that foot from the time it's left its coronary band, we are not in alignment with the coronary band. By putting alignment with the coronary band, and a lot of times these horses are so severely affected that it looks like a drunk put the shoe on to put this in alignment with the frog stay, and it gives tremendous relief to these horses. I'm still trying to work my way through it. I noticed a lot of these horses here recently, they will often have a head nod, a head nodding lameness that I used to try and block out, and I never really could make a change out of them. But I noticed that this isn't really so much a head nod of when the leg is contacting the ground as much as it is a head lift when he's trying to extend that leg. And it's kind of like if you got a real sore shoulder, you know, you're going to turn your head and that sort of thing to reach out.
Every day.
That's kind of what these horses do. They have this kind of action, and it looks like a head nod, but it's not a getting off the weight. It's an advancing the leg. And I found that I knew this was a problem. I found out that and I was doing flexions. I knew this was a problem. I had a trainer I could not convince of it. So we were riding the horse and doing flexions. And when flexing the leg, typically we're trying to evoke a lameness, trying to make something worse to give us an idea of where we need to look. I went all through the lower limb. That didn't change him at all. And so I did, okay, I'm going to do a shoulder extension. And we did that shoulder extension. And this horse, I mean, was lame as he could be with every step, throwing up his head. We did that shoulder extension, and then the rider took off with him. And that horse was dead letter perfect for about halfway around the circle. And then he started doing the limping again. Come back, he was sore as he could be. I stretched that out again. The pain went away, and then it came back. Once we got, and I worked with a farrier. He thought I was nuts, and he told me, he said, "You're not talking farrier. You're talking something else, and me and you are not communicating." That comes back to the farrier-veterinary relationship. He and I, I was saying one thing, and he was understanding me to be saying something else. And we finally worked our way through it and changed that horse's shoeing just a tiny little bit of moving that breakover point from where it was twisted to the inside and then lined up with the apex of the frog to moving that breakover to where it lined up with the frog stay. And that horse completely resolved that lameness. And that's when I started really realizing, boy, we have such an immense effect on the nervous system. And it's not just that, it's also in their back. I see so many horses, if that bony column in alignment in right and you've got a long breakover and everything's running down under, they're going to be sore in their back, across their withers, and that sort of thing. And getting everything lined up and back, and that's where the art of the farrier. My feeling has always been, I'm going to provide some science here. I'm going to give you x-rays. I'm going to give you everything I can so you can image what you've got there so that you can do your artistic work of putting that back in alignment. And so, like I said, it's an absolutely critical relationship that we have. And I get it, you know, farriers go, that idiot's never put a shoe on in and they're absolutely right. I've not put a shoe on in my life. I like to tease farriers. I tell them, anybody that spends all day working with a butt higher than their head would consider the law of gravity.
Well, there's a lot of truth to that.
Yeah.
I can prove it.
Exactly. All right, we're going to take a quick...
farrier that will say amen to that.
Yeah, we're going to take a quick little break, and when we come back, we're going to dive into the holistic approach to lameness. So stick around. You're listening to Equine Dynamics with Mike Stine. He'll be right back. Don't worry.
Have you seen that, Mike?
Yeah, I think so.
He's lying.
It sounds good for the moment for me to say that. But
yeah, let me tell you what you do.
Right.
You pick up, if you stand in front of a horse and if his knees look a little turned out to you, pick up that foot, bring it up to the elbow. If it won't just flop a full hoof width outside of that elbow, you got it.
Okay.
You pull his shoe, and that foot will automatically come right out of that elbow. And I bet yours aren't doing it. But I bet you see others.
Yeah.
that you walk up on, and they've got it. And
We know,
and I mean, they'll be so sore through their scapula and their lower neck.
yeah. The thing with a frog stay is no matter how much you just distort the rest of the foot, that tends to stay where it is.
Exactly. That's kind of like looking at a tree, you know, like a willow. It's pretty strong there at the base.
Right.
But if it's something leaning on it, the rest of it's going to bend.
Right. Yeah.
And that's exactly what that frog stay is. It's the origin of that frog.
Right.
It doesn't lie. I had a fairy the other day tell me it's been a while. Tell me that frog doesn't lie. I said, it lies like a dog.
Yeah, that, you know, measuring off the apex of the frog, and you've got a distorted, stretched frog. Well, that's a whole different place anyway.
Yeah. It's so anyway. I just it's a big thing.
He's passionate about it.
I've got a lot of guys that want to work with me on it, and some guys just think I'm nuts. So that's fine. I don't worry about that anymore.
Yeah.
Non-believers stand back.
Yeah, exactly. All right. When we come back, welcome back to Equine Dynamics with Mike Stine. Don't forget, if you have a question for Mike Stine, you don't want to go live on the air with us, that's fine. A lot of people don't like to hear the sound of their voice. They get shy
I don't
sometimes.
like to hear mine.
You can go to equinedynamics.com. At the very top of the page says contact us. Fill out that little form. Ask Mike a question, and make sure you put a physical return address on there as well. And if we read your question here on the air, or we will answer you or your email no matter what. But if we read your question here on the air, we'll send you out a prize pack. We've got a new logo coming up. We're going to release on the next show.
Right.
Because we're going to wrap up season 12 here next week. And we're going to start season 13 coming into June. So we got a new logo. We're having some new swag and stuff for you. So if you want to get those now, go over to equinedynamics.com. At the top of the page says contact us. Fill out that little form, and we'll get it out to you right away. And over to my far hand side, my very own contact sport is Mike Stine. How are you?
I'm doing good, Travis. How are you?
Doing well. And joining us this week here in the studio is Dr. Mark Wooten, DVM, joining us here. And you can see him over on YouTube as well. Thank you very much for joining us this week.
Thank you. My pleasure.
So you were talking about the Fairies effect on the nervous system, and I brought up Taryn from last week's show, how she's the body worker and all that stuff. Now you were leaning into like almost like a holistic approach to lameness. So kind of dive into that theory that you're kind of bouncing around with.
Yeah, I I graduated about 50 years ago.
Sure.
Last week.
Not quite that long, but it's getting up there. And over the length of my career, I first got me into doing typical veterinary work, doing the lameness work, and having great success with it. It worked really well, but always knew there's something there that I'm missing. Always there's something there that we're missing. And from my own personal experience, I got hauled out of barns on a stretcher a couple of times because my back went out, and it was so horrible. And the MDs, to be quite honest with you, weren't doing anything but giving me drugs to take. And my receptionist at the time was dating a chiropractor, and she convinced me I need to go see him. I'm going to see that quack. And I finally went, and it gave me my career back. And I said, my gosh, this is amazing. I wish I could do this for a horse. And he said, well, there is a school that started for veterinary chiropractic. And this was back in the early 90s. And Dr. Sharon Willoughby, I give her a lot of credit. Dr. Willoughby was a veterinarian who practiced in the Davenport, Iowa area. And she saw, which is kind of the birthplace of chiropractic. She saw so many of her clients going with all different species of animals going to chiropractors and seeing dramatic relief out of it. And she said, I got to learn something about this. And so she sold her practice and went back and became a DC entirely to develop veterinary chiropractic. And so she did. She practiced over the years and developed techniques for veterinarians and then started a school. And so I attended that and had practiced chiropractic a long time. For 3 or 4 years. And then I decided, let's go back and let's go look into acupuncture. There's got to be something, a lot of success with that. And so I went through the certification for acupuncture. And that stuff is amazing.
Oh yeah, I've had it done. I had sciatic bad nerves and stuff, but they call it dry needling when they did mine. So I guess the acupuncture, the Eastern medicine and Western medicine is the dry needling. On horses, do they refer to that the same way, or is it all in one?
Yeah, they're doing both. To be quite honest with you, because I did do the chiropractic first, and I just kind of felt like, and a lot of people might argue this with me, that we were both going at the same thing. And I wasn't really clear on why it seemed like we were kind of going at the same thing. Because I would go over a horse, find a lot of acupuncture points that were lighting up and that sort of thing, and do the adjustment, and they would go away. And that was like, that's interesting. And a few years back, I've been, like I say, doing both of them together. And then I got a call from Dr. Carl DeStefano. Dr. DeStefano is a human chiropractic neurologist who was one of the early instructors at that very first course in veterinary chiropractic. He went through the course and then became one of the teachers. I used to kid him, that's kind of like community college. You go long enough, they'll let you be a teacher.
Yeah, exactly.
Anyway, he was amazing. He blew me away with his knowledge of neurology. I mean, it was just incredible. Well, over the 25 years that he started doing veterinary chiropractic, he started taking from his practice on people the applied kinesiology and developing veterinary techniques. And he did that for a long period of time. And I'm not sure how many of y'all are that familiar with applied kinesiology, but it's muscle testing. It's testing the muscles, which is actually testing the nervous system. So he's developed all these techniques, and he took them to all the different chiropractic schools that he had taught at all of them, and told them, hey, we need to put this in our curriculum. They were kind of like, nah, we're good, and I get it. They didn't want to spend all the money to upgrade their entire curriculum. So Carl decided to start his own school. It's called Health Pioneers. Anybody that's listening to this, if you're a human chiropractor or a veterinary chiropractor that wants to do horses, dogs, cats, whatever, you need to go through his course. He contacted me and said, Mark, you need to come back to school. I said, Carl, I'm 64 years old. I don't think I want to go back to school. And he said, yeah, you really need to come see this. And Carl had always done a lot for me, and I really respect him. I said, okay, I'm gonna go to the first module, see. Totally blown away with what he had developed, what he was doing, and I was bought completely in. So, all that being said, the holistic approach that I have found is that acupuncture is tied into the applied kinesiology that is tied into the acupuncture, chiropractic, and veterinary practice. They're all together. You've got to use them all. One of the first things I was taught 10 years ago at the University of Tennessee, veterinary orthopedics, Dr. Joe Alexander taught us, and I don't know, I guess the Lord put this in my mind and it stayed there. Very first thing he taught us was the cause of joint pain and pathology is joint instability, which, if a joint's unstable, it's going to be painful.
Yeah, you're compensating.
Yeah, it makes good sense. Okay, well, and that's where they stopped. They didn't. The question was that Carl taught me is, why is the joint unstable? Well, the joint's unstable because the muscles, tendons, and ligaments that stabilize that joint aren't functioning properly. And Carl's question is, well, why aren't they functioning properly? Well, because there's a disafferentation, an improper nerve supply to those muscles, tendons, and ligaments, where they're overfiring, pulling the joint out of alignment, out of stability, or they're underfiring and not doing their job to maintain stabilization. Well, what's wrong with the nerve? There is impingement on that nerve that supplies those muscles and tendons and ligaments, so they're not functioning properly. Using muscle testing, and I have found, and what I use a lot, are the acupuncture points go right along with it. I can trace down those points, like if I've got an unstable stifle, those stifle points will be screaming. If I use those points to localize the muscles or along the spine that I need to adjust, that will resolve. You get those muscles, tendons, and ligaments to firing properly again and stabilize the joint. And a lot of times that is all you need to do. It's quite amazing. I'll take horses and put them on the jog and lunging and go through them, find these points, trace them back. You'll see some lameness. You might adjust that, and boom, you get the muscles firing properly again, and the lameness goes away. Now, this is where the veterinary part really comes in. A lot of times you've had instability there long enough that now you have pathology. Just like Dr. Alexander taught me years and years ago, primary cause of joint pathology is instability. And that's why you see all these bony reactions around an arthritic joint, is the body's trying to stabilize that joint. Well, that's kind of circling the wagons and shooting in. But anyway, that's what it's doing. And once you have pathology, I mean, I can adjust that and I can get those muscles, tendon, ligaments firing properly again, get the joint stabilized. But we're too far down the line. We've got pathology that, as a veterinarian, I have to address that. Somebody said something to me the other day that I was talking with my colleagues, and he said, I don't want to be a chiropractor. And I said, I don't know how I could practice medicine anymore, particularly without the AK and the chiropractic. They're all tied together. The AK leads you to where you need to adjust. You know, the idea of chiropractic being bone out of place is the tried and true way of thinking of it. It's been successful for over 100 years, but it's really not the case. Bones are stupid. They only do what the muscles tell them to do. And muscles aren't a lot brighter. They only do what the nerves tell them to do.
My wife has a chiropractor that comes out, and she always tells me, hey, you know, the chiropractor's coming out this week, and I've met the chiropractor, and I'm thinking, I've been to a chiropractor before, and the guy that worked on me, I mean, he looks like he could be an MMA fighter. I mean, muscles like this and shoulders like this, and real nice guy, worked me out with my sciatic nerve and stuff. I met my wife's chiropractor for a horse, and she's about, 5'2", maybe 105 pounds. And I'm like going, how does a chiropractor of that size get any movement done on a horse of such magnitude? Is it more theory? Like, if I press on this will work, as to actually physically?
She's only 5'2", wearing riding boots.
Exactly. So, I mean, being a chiropractor, how does that difference in mass trade off?
I'll be honest with you. When I first started back in the late 1900s, I was doing
really exactly.
Now people look at me and go, are you going to do anything? It is that light a touch, because the thought, thinking about it, just what I said, I'm not pushing on bones. I'm working on nerves. I'm stimulating nerves that tell the muscle to fire because it's not doing its job. Or I'm stimulating a nerve, telling it to chill out, to quit, take that muscle out of spasm, and that quits pulling on the bone. Okay, so it's really not the best chiropractors I've ever seen. They don't look like they're doing much of anything. Dr. DiStefano, it's amazing. He's just so light in his placement, and the more experience that I've found, and he says always less is more, and that's very true with that. But it's so precise. The basis of most chiropractic is motion palpation. You're looking for areas of fixation. With this, you're actually looking for areas of muscles not firing right. Now, it gets into a really involved, much longer kind of discussion than what we have time here of doing that testing. But it is fascinating the way you can test the muscles and trace it back to where you need to work, or even trace it back using acupuncture point. They're going, nope, you've got true pathology in this joint, and you have to address the joint. Stabilizing it ain't going to work. You've got to address this joint.
All right, we're going to take a quick little break and one more little segment, and we'll let you get back to playing with your ponies. You're listening to Equine Dynamics with Mike Stine. He'll be right back. Welcome back to Equine Dynamics with Mike Stine. If you're enjoying the podcast and you like this podcast to perform at your clinic, your location, if you got a barn full of people, we can do this exact same podcast right in front of your very own front stall there. We can do it in the tack room if you need to. All you have to do is reach out and go to equinedynamics.com. At the top of the page says clinics. Fill out that little form. We'll schedule you in. We got some shows coming up here in the next month or two, some live performances, and we'll let you know the closer we get to those dates where we're going to be, so you can come out and see us. We broadcast just outside of Charlotte, North Carolina, a little town called Marshville. Population 2,500 people, but we go all over Union County. We go over Mecklenburg County, and sometimes
North and South Carolina.
North and South Carolina as well. So if you'd like to be part of the show and you'd like us to come out there to your location, even if you got like a spring fling, you just want us to set up a booth and sit out there and shake some babies and kiss some hands. Is that the way it goes?
Or if they need somebody to throw rocks at.
Or throw rocks at or anything like that. We can do that as well. Just fill out that little form on equinedynamics.com. Keyword clinics, little drop down menu. Oh, my very own favorite kissing hands over there is Mike Stine. How are you?
I'm doing good. How are you, Travis? And thank you for being with us, Mark.
And joining
My
us,
pleasure.
And joining us this week is Dr. Mark Wooten, DVM, joining us here on the podcast as well. So, Mike, what did we learn today?
What did we learn today?
Talking about the vet farrier owner relationship. Mark, go ahead.
Just how critical that is to the well-being of the horse. We can't work in a vacuum. We have to have a cooperation between the farrier and the veterinarian, and we have to have an owner that is on board and understands what we're looking at trying to accomplish and giving us some guidance of where they want to go. Because it can be a very expensive procedure, and I don't want to put anybody in the poorhouse.
Everybody's got to be on the same page. And for me, one of my pet peeves anymore is direct communication between myself and the vet and that sort of deal, because things get too twisted up.
Not he said, she said type deal.
Some playing the game of telephone.
Yeah, exactly. Also, the farrier's effect on the nervous system and how those correlate together. Mark?
That's an evolving thing for me. I'm starting to recognize more and more of it as we've played around with different shoeing techniques and that sort of thing, and just the effect that it has on the body, and I mean what oversees everything is the nervous system, and the effects that we can have with the alignment of the bones and that sort of thing in the lower limb. That's the first part that's touching the ground. That's where everything starts, and the hoof is huge to that, and it's sending so much information to the brain and the proprioception of where everything is.
Mike?
Yes. It's chicken or egg, whichever way you want to look at it. But I know if there's problems going with the body as far as keeping the foot where it's supposed to be at the end of the shoeing cycle, you do see the locked up body and body not working correct and what's happening, growth patterns in the foot.
And Dr. Mark, you've got a new foal right now that you got to keep an eye on that starting right now that just came out, making sure that the limbs and everything are not starting to fade or twist out or whatever that you're looking for in the first couple months of that birth.
Oh, absolutely. Fortunately, with this little guy, he was a little guy and quite mature, a little reining horse, so they always come out not very big, but really strong and stout. So, yeah, no, it starts very young. It starts very, very young as far as their trimming and that sort of thing to make sure everything's growing properly and the joints are working properly. And
also the advancements of veterinary chiropractor and holistic approach to lameness. Mark?
Well, this is why I'm still practicing. I mean, I've been doing it for a long time. And I've been just learning this here in recent years, and it's made it so much fun. I just have really gotten excited about the work that I'm doing, the things that I'm learning new. It's always something very new that I'm learning, and each horse is quite the individual when it comes to this. And there's just so much information that you can gather with combining all this together, and it's just made it just a blast to do, and I'm very excited about sharing it with other veterinarians and farriers and chiropractors and whoever, because I'm so grateful for those who shared with me. Dr. Redden, Dr. DeStefano, Danny Dunson, Dr. Willoughby, Dr. Joe Alexander, Dr. John Hitton, all those people that go back for years and years some of them unfortunately aren't still with us, but they had such an effect on me, and I feel like I've kind of taken this a little farther along, and I sure want to share it with everybody that I possibly can, because it really made it fun.
And something, a prime example, you were talking about Doc Redden. He says, you know, we were doing it this way this week, and then next week I found a new way to doing it. So It's like, even though you've learned something today, carry on that education, because there's always something new and evolving, Mike.
Right. And, you know, I met Mark because of our connection with Doc Redden, and both of us constantly looking the thirst for knowledge. And, there's always, Doc's always pushing the limits on what can be done. And, I've learned so much from him, learned so much, made so many great connections through him over the years, and look forward to learning as much as I can from Mark and Danny, you know, because these guys we've been running down the same road, a little different direction, you know.
All right, Mark, how can our listeners get a hold of you if they have any questions or want to come out and visit you or just get more information from you?
Well, the name of my practice is Equine Performax, PERFORMAX, Veterinary Services. We also have Equine Performax Veterinary and Rehabilitative Services that does the rehabilitation part. We're at the Jaekle Center, that's spelled JAECKLECENTRE.com, and you can find that. Our office number is 855-523-2553, and our email address is vetservices@jaeklecenter.com.
All right, Mike, you got anything else you want to add?
No, just look forward to the path of learning, and thank you, Mark.
And we'd like to thank Dr. Mark Wooten.
Yeah, we'd love you guys to come over and see the place.
Hey, we got an open invitation. We're going. We'd like to thank Dr. Mark Wooten for joining us this week on the podcast. And don't forget, for every podcast we do, we have a matching video over on YouTube. Make sure you subscribe to that over there as well. On behalf of Mike Stine over there.
Thank you. Enjoy your ponies. Have a good day. And thank you, Mark.
And we'd like to thank Dr. Mark Wooten for joining us this week. My name is Travis, saying see you next week. All right, audio's off. Camera's still rolling. Good job, Mark.
Thank you, sir.
Thank you.
That was fun. I was going to say, did you have a good time?
Yeah, very much. I enjoy it. You know, I love, like I say,
Hey, Lucky.
Good night, Dad.
I love this
Good
and
night,
what I'm
Dad.
doing, and
Good night, Dad.
sharing it with others, and it's just a blast.
So I'll tell you what's going to happen